Have you ever imagined waking up one morning to realize your lower extremities are bilaterally paralyzed due to weakness? Believe it or not, this nightmare is real and affects 3,000 to 6,000 Americans each year. Hi, my name is Eddie Diaz, and together with my group of fellow nursing students, we're going to be presenting Guillain-Barré syndrome and myasthenia gravis, both problems of the peripheral nervous system.
Guillain-Barré is an acute inflammatory syndrome that affects the axons and myelin of the peripheral nervous system, causing motor weakness and abnormalities in sensory perception.
Good morning, Miss Miguelina. How do you feel? You feel bad? Okay, let me bring you the wheelchair. Okay, wait a minute.
Segmental demyelination destruction slows the transmission of impulse from node to node, damage of the motor neurons, resulting weakness and damage of the sensory nerve, send forward message to the brain, affecting the patient's sensory perceptions.
How are you? What does it bring you today?
Very bad. I feel horrible, doctor. I can walk.
Oh, I can see. Why you're in a wheelchair? What happened to you?
I feel very tired. I feel die. I feel tired. I fall in my bathroom last night. I don't have a good vision. I don't know what happened to me.
Okay, so let me ask you something. When do you start feeling like this?
I don't know, 1 week. I don't have. No tengo fuerza, doctor. No tengo fuerza en las manos. My muscles are.
But what specific part of your body starting these symptoms?
The legs. Horrible.
So you can walk because you have uncoordinated movement.
I have uncoordinated movement, and when I think I want to have a movement, it doesn't happen.
Okay.
I don't know.
So have you ever checked your blood pressure or your sugar
My
level?
I feel terrible. I think my blood pressure is down.
Okay, I'm gonna run some tests on you. The following diagnostic tests may be done: cerebrospinal fluid sample, EKG, electromyography, nerve conduction velocity, and pulmonary function test. Obtain a complete health history and assessment. Ask the patient to describe symptoms in chronologic order is possible. Inquire about the presence of pain, numbness, and paresthesias. Miguelina, here we have all the results are positive to Guillain-Barré syndrome. So the patient may receive either plasma exchange, also known as a plasmapheresis, or IV immunoglobulin.
Nursing interventions include provide information and take care of patients while on plasmapheresis and during the infuse of IV immunoglobulin. Nurses have to weigh the patient before and after the plasmapheresis and care of the venous access site. Also give the IV immunoglobulin slowly and increase the rate based on the patient's tolerance. To promote airway patency and adequate gas exchange, nurses need to implement aspiration precautions that include elevating the head of bed to 45 degrees or higher. Also assess cognitive status, especially in older adults, because a decline in mental status often indicates hypoxia. Monitor vital signs closely and report any change in heart rate and blood pressure to the healthcare provider immediately is very important. Also, to prevent thrombophlebitis, apply antiembolums, stockings, or compression boots, and give prophylactic anticoagulants as ordered. To prevent aspiration, test for dysphagia prior to restarting oral drugs or nutrition and encourage coughing and deep breathing. We may need to use an incentive spirometer to prevent pneumonia or atelectasis. Oxygen may be administered by nasal cannula at a flow rate prescribed by the healthcare provider. To improve mobility and prevent complications, assess the patient muscle strength every 2 hours. To ensure safety, assist the patient with walking, transferring from bed to chair, and position changes. Perform active or passive range of motion exercise at least daily. Monitor fatigue level and provide adequate rest periods between activities. Assess skin integrity at least daily because of the risk of pressure ulcer. Administer medication as others, such as analgesics to relieve muscle stiffness and spasms, and opioid for pain management. To provide other pain control measures include massage, ice, heat, relaxation techniques, hypnosis, and distraction like music and visitors. To promote communication, collaborate with a speech-language pathologist. A simple technique involves eye blinking or moving a finger to indicate yes or no. Provide emotional support to the patient and her family. Encourage the patient to verbalize feelings about the illness and its effects, if possible, while fostering hope.
In MG, antibody produced by the body attached to receptor responsible for binding neurotransmitter and the muscle. Acetylcholine is the specific neurotransmitter that normally transmits impulses between nerves and muscles. In MG, the acetylcholine cannot reach the muscle because it is blocked by antibody to its receptors. The receptors is damaged by this, which result in muscle weakness.
Myasthenia gravis is an idiopathic in most patients. Although the main cause behind its development remains speculative, the end of result is a problem of the immune system regulation. Even in patients who do not develop clinical myasthenia, anti-acetylcholine receptor antibodies can sometimes be demonstrated.
Patients with myasthenia gravis typically experience muscle weakness that gets worse with activity and better at rest. With myasthenia gravis, the muscles are fatigued and they get tired when they go up the stairs and when they lift objects.
As you can see in this video, with repeated motions, patients tend to get exhausted.
Another sign and symptom of myasthenia gravis is ptosis, which also causes diplopia, which is double vision.
This patient has myasthenia gravis. His left upper lid is drooping. When he looks to the right eye does not fully abduct. When he looks up, his right eye does not subduct fully. When he looks down, his right eye does not interduct.
Patients with myasthenia gravis also experience difficulty swallowing and chewing. Because of the muscle weakness, these patients have difficulty breathing, which eventually leads to respiratory failure and can lead to their death.
The nurse must perform a comprehensive nursing assessment, including the medical history and patient's description. After a focused assessment, the physician will determine which diagnostic test should be ordered.
There are several ways to diagnose myasthenia gravis. With the Tensilon test, it is a short-acting anticholinesterase which is given IV. The patient with MG experiences a significant but brief increase in muscle strength. This is a positive result. Also with a blood test, also with an electromyogram, which detects delay or failure in muscle fibers, And the last one, but not least, the thoracic MRI, which shows the thymus gland enlarged or abnormal.
Pharmacologic therapy includes anticholinesterase medication and immunosuppressive agents, such as corticosteroids, azathioprine, cyclosporine, plasmapheresis, and intravenous immunoglobulin.
Hydrophonium is primarily used for myasthenia gravis. High doses of corticosteroids commonly are used to suppress autoimmunity. As you can see now, after the administration of this medication, the symptoms disappeared.
Therapeutic management of patients with ND. First, monitor respiratory status. Maintain suction and emergency equipment. Ensure proper medication. Monitor feeding and ensure proper nutrition. Provide eye care. Instruct patient to avoid temperature extremes, emotional stress, drug, alcohol, and exposure to infection. Educate on signs of cholinergic or myasthenia gravis.
Another nursing intervention includes establish accurate neurologic and respiratory baseline, stay alert for signs of impending myasthenic crisis such as increased muscle weakness and difficult talking or chewing. If surgery is scheduled, the nurse must provide perioperative teaching.
Que lo que ella está diciendo está también en
Corta.
Se aprieta.
¿Te sientes bien?
Ay, estoy muerta.
No hable. Ahorita que la voz de Patricia va atrás. Espérate, vos no. Sí.
Mientras yo voy caminando, tú tienes que ir alejando.
No, pero no me enfoque la nariz, que la tengo muy grande.
Okay. Nurses should perform a comprehensive nursing assessment. Uno. ¿No?
I have you don't know what do you say in English? I have an hormigueo. What is that?
So you